All right. Well, welcome everyone. Thank you all for joining. My name is Veronica Saldate. I am the crime prevention liaison here for the Austin Police Department's Office of Community Liaison. I am not an officer, but I get to, go around to our community and do fun things such as such as what we're doing right now, and provide some information to various communities. I am here because I am the chair of the Seniors and Law Enforcement Together Committee. And we do this every year, usually in person. This is our first time trying this virtually. Um, so yeah, let's see how it works out. We've got, oh yay, Clinton is here. Welcome, Clint. So what I'm going to go over first, we'll talk about a little bit about seniors and crime prevention. So I have a presentation for you. I have a little PowerPoint that I'll just kind of talk through and, just try to give you some tips to prevent, scams, frauds, things like that, a little bit of safety tips as well. And then Jesse here will take away after me. Take over is the word I'm looking for. After me. Okay. So again, if you have any questions, just raise your hand or put them in the chat box and I will gladly answer them for you. Okay. I am going to try and share my screen here and see if y'all can see it. Okay. Let's see. Can you guys see that?
Yeah.
Perfect. Okay. So a little bit about seniors and crime prevention. I said we're part of the Seniors and Law Enforcement Together Committee, where we try to educate the senior community here in Austin on, just staying safe, not only physically, but also when it comes to, financial crimes and things like that. So basically what I want to talk to you about today is we're going to talk about different crimes that are, the most popular against seniors. Okay. And we're going to look at what measures we can take to prevent those crimes. Okay. So we'll review some data, some of the demographics, and, talk about, like I said, the major crimes and some tips to prevent those crimes. And I should say, this subject matter is near and dear to my heart, just because my mom was a victim of a scam, and over the phone, which I'll tell you all about later. But just recently, my aunt was also a victim of something that, again, I will give you the story for that as well, just so that y'all know what is out there and what to look for. Okay. So we're going to cover financial crimes. We're going to cover property crimes, and then a little bit of violent crimes at the end, which aren't actually not that big a part of what seniors deal with, but it's still good to talk about. Okay. So starting with financial crimes, we have frauds, we have scams, identity theft, healthcare fraud. There's so many out there. And most of those, I'm sure y'all get all those spam calls with people, telling you that, oh, it's the IRS, oh, it's the Social Security office, oh, it's so and so, and you need to give us your money, and you're behind on this, you're behind on that, you need to give us a call. So we'll talk about those as well. Most of these criminals are looking to take, obviously, some money from you, but also, credit and any other assets that they can. And most of the time, all these people are they're very charismatic. They have excellent people skills, and they know very well how to work computers and all of that. So, that's why sometimes it's hard they sound very legitimate, right? So sometimes it's hard to just say, oh, wait, no, I don't know what you're doing. I don't know who you are, and hang up the phone, right? So that's kind of what we're going to talk about. So why are seniors such a target of financial crimes? Well, for most seniors, they have accumulated resources. Sometimes, many of the seniors own their own homes. You have insurance, you have pension plans and savings and all of that. That maybe isn't, they're not closely monitored. Sometimes people just kind of have, oh yeah, I have an account at so-and-so bank, but I haven't touched it in years. And you're not looking at it every week or every month just to see what's going on. So sometimes they go unmonitored and you're not aware of what is happening. So furthermore, you guys are, the senior population is accessible by phone, by mail, sometimes they have the time to listen. Sometimes, sometimes we're too nice and we don't want to just hang up on someone. And it's like, for example, you can't, like the very last bullet point says, you can't perform your own home repairs, which is another way where people defraud the senior population. So, it's just taking advantage of things that the bad guys know that the senior population needs. So, if you have, many seniors are isolated because of a disability, or, maybe they're, they don't have a lot of friendships, or, even if there's a lack of transportation, sometimes it's no good. Furthermore, like, I think, at least every senior that I've ever worked with is very friendly, and, sometimes they can be a little bit trusting, and sometimes you're embarrassed to admit, that, hey, we were a victim of this crime. And this is where I want to tell you just a little story about what happened to my mom. My mom is 78 years old. And a couple of years ago, she received a phone call from somebody who said that, oh, hey, this is your nephew, so-and-so. And my mom lives in El Paso, and my cousin who was calling her said, yeah, I'm here, on the other side in Juarez, and I can't cross the border because my car died and I need some money to fix it so that I can come across. And long story short, my mom believed him, and she wired some money, to the information that she was told by this random person on the phone. And so she sent him some money. And about a couple of hours later, she called me and she said, hey, this just happened. Your cousin is over here and I don't know what's going on. And he told me that his car is broken down and that he can't get over here. And I said, what? Because I had just seen on, maybe like Facebook or something that he was home. It's not like he wasn't visiting, he wasn't doing anything. And I said, well, let me find out. And I called him and I said, hey, are you in Juarez? And he's like, no. So, I told my mom and I was like, that wasn't him. And she was like, what? And I think she was more worried about the fact that someone had taken advantage of her, and she felt terrible because she said, it totally sounded like him. He knew that I had a nephew named, I think they said Oscar. But, regardless, she actually got mad at me for asking her questions, and I understand that. I understand, like, it was just, the anger was just, directed toward the wrong person, because she felt like she had been made a fool of, right? So thankfully, we were able to change her bank account number, and even though we couldn't get the money back, we did report it as fraud. And I told my mom, I was like, don't ever, if that ever happens again, make sure that you double check with whoever it is that's saying like, oh, it's me. Make sure you give them a call. Make sure, especially if they're giving you some other random number that you don't have, as, hey, this is the number for my nephew. So that's why I've always kind of been interested in sharing information about this. I said, because my mom recently was a victim of this. And even though she only lost maybe a couple of $100, that's a lot of money when you're on a fixed budget. So it's terrible. So just make sure if that ever happens to you, that somebody calls you or anything, make sure you double check to make sure that that person is who they say they are. Okay. And don't ever be embarrassed to admit that something like that happened. Okay. Nobody's going to make fun of you. No, we're just going to try to help fix the situation and make it to where it doesn't happen again. Okay. So, this is just a little bit about fraud and what it involves. And, most of those, it's like, okay, if it sounds too good to be true, then it probably is, right? I'm sure you've all heard oh, you can earn money while working from home, or you have, this great opportunity to invest in this, or, something like that. There's always something, but you all know the saying, if it's too good to be true, it probably is, right? So, so yeah, I'm always very wary about stuff like that, much more so since I started working here. I always question everything now. I was like, wait, what? No. So, so fraud can take many forms. We talked a little bit about home repairs, because sometimes, I know my mom, for example, isn't going to be able to put in new carpet if she wanted to in her house, right? So she'll have to have somebody come out and do it. And I mean, I'm sure you've all heard stories about contractors that come out and start something and then take the money and never finish it and all of that. So, that's definitely one. Auto repairs, I feel like that, that happens to everyone. This isn't specific to the senior population. I feel sometimes, as a woman, especially, you go and get your car fixed and they're like, oh, well, miss, this is what's happening. And, I had a guy once tell me, he's like, you need new tires. Your tires are about to explode. Those were his exact words. If you drive out of here, your tires will explode. And I'm like, excuse me? And I was like, I need you to show me. I'm like, what are you talking about? And sure enough, we went and he had my car up on there. And well, look at how thin this thread is and all this stuff. And I'm like, okay. I'm like, one of them is a little thin, but the rest of them, don't tell me that my tires are going to explode the moment I drive out of your place of business here. So I said, thank you very much. Take my car down. And I went somewhere else and got tires. But, they will try to take advantage of you in any possible way they can. So, just be aware and be just a little untrusting, a little bit more than usual. So these statistics are definitely a little bit old, but you can see, because I know our older population is actually a lot more than just 12%, but they make up a large part of like the telemarketing victims, for example. Okay. And like you said, I always, the very last sentence on here, a telemarketing fraud artist told investigators that it is an article of faith in this business to go after old folks, which just makes me so angry. So that's why I want to, send out this information and try to, even though we don't have a whole bunch of people on this call, I hope that, those of you who are here will share this information with all your friends and your colleagues so that we can try and spread this information out to everyone. Okay. So a little bit about, the person who's trying to take advantage of you, they're stealthy, right? They're stealthy. They know what they're doing. Like I said, and sometimes they're very charismatic and they can be on the phone. And one of my favorite things is when they call somebody and say, hey, grandma, it's me. And then grandma says, oh, hi, Tom, is this you? Yes, grandma, this is Tom. And that's how they get in. And it's, so don't ever say that to someone when they call you like, hey, this is me. Who is it? Me who? Like, like I said, always ask the question. Okay. And the second point here I'll tell you about what just happened to my aunt, because of what it says about, someone trying to get into your home or using the restroom or something like that. My aunt, and this actually happened in Mexico, so this is obviously happening worldwide. My aunt is 93, I think, 93 years old. No, 94. And my cousin lives with her, but my cousin had stepped out to get something, like she went around the corner to the store to get something. And in that time, somebody rang the doorbell and my aunt opened the door and they said that they were looking for my cousin. And so my aunt said, she just left. She went to the store. She'll be back in like 10 minutes. If you want to come in and wait for her here, you can. So she let this person in, and while she was in there, she ransacked the house. Um, and like I said, my aunt is 97. It's not like she can, get up real quick and like hit someone or whatever. But there was not much she could do. And she was in and out. I mean, less than 5 minutes. It's almost like she just went to like my cousin's bedroom and stole some jewelry and ran out. So before my aunt even knew what had happened, the lady was gone. So if ever someone knocks on your door and you don't know who they are, even if they say like, you know what, you can wait outside. You're waiting for someone to be here, go wait outside. Okay. There was another case that I had here of a woman, same thing. They knocked on her door and it was a girl who was crying, saying, my boyfriend just dumped me here. We are from Dallas. I don't know where I'm at. Like, can you please help me? Like, just give me some information as to how to get to wherever. And the woman led her in her home, and then she wouldn't leave. She stayed for months and months. She was at an apartment complex, a 55 and over apartment complex, and because she had let her in, this poor woman had to file eviction proceedings to get that girl out. It wasn't just, she doesn't live here, get her out of here, and because she had invited her in. So it took probably about 4 months to get this girl out of her house, out of her apartment, while this girl was, eating her food and, staying in her apartment and bringing people over. And so, yeah, that was terrible. And the thing is, the apartment complex, they said, if we do eviction proceedings, we have to evict everyone in the apartment. So that's why you have to do it yourself. So, just another added stress for that. So long story short, do not let anyone in your house if you don't know who they are. If anybody ever comes knocking on your door, like, oh, please let me borrow a phone, I need to call 911, something is happening, I will gladly call 911 for you. Let me know what is happening. I'm not giving you my phone. I'm not letting you in. I don't care if you're about to pee your pants because you really have to go to the restroom. I'm not letting you in my house. Okay. So just think about that. So again, very stealthy people. And sometimes you don't know if something did happen, if a theft had occurred. I know another one of our SALT members always tells her story that she actually had a in-home health aide steal money from her just right in front of her. Like she would go and go to the grocery store and pay with her card, pay with her credit card or her debit card, and then she would just take money out without this lady knowing. So she did it right in front of her. They were at the grocery store. So sometimes you don't know until you go and check your bank account and you're like, wait a minute, where did all this money go? So, again, it's just, you have to be very vigilant and have to be very aware of what's going on. Okay. So that was a little bit about, financial crimes and fraud and stuff. So let's talk a bit about identity theft, which happens all the time, right? But seniors aren't usually a large percentage of that number, but it's always good to just go through it anyway. Sometimes when it can happen, we all get those pre-approved mailings in the mail, like you're pre-approved for a credit card, like here you go. And somebody maybe steals your mail and they apply for it and under your name. So, and sometimes when you get your bills in the mail, again, it gets stolen. Obviously, if you get a wallet stolen or a purse stolen or something like that, or even if you have just a receipt because you just went to a restaurant and, usually they don't have all the credit card numbers on there anymore, thank goodness, but it'll usually have your name and maybe the last 4 digits of your credit card number. But, think about all of that stuff and make sure you're shredding it or just throwing it out somewhere where it's not going to be easily accessible by someone. And I always tell people, try to pick up your mail every day, especially if if your mailbox is out in the street, right? Sometimes if you live, let's say, in an apartment, you have maybe mailboxes that are inside and in the building and they're not really out and open to the public. But if you're at home and there's, your mailbox is by the curb, make sure you pick up your mail every day and don't just leave it piling up there. Okay. And again, because then they're gonna use that information, and now they can open up credit cards. They can, even like get a mortgage if they want. So even things like your driver's license number, which a lot of people ask for various things, that can be used fraudulently. So again, make sure that you're always giving that information to the people that really need it, and that you're giving it to them because you called them or you're seeking out their services, not the other way around. Okay. So if ever you do become an identity theft victim, there are a couple of things that you can do. Again, usually by the time you discover it, it's probably a little bit later, because you're like, wait a minute, how come I'm getting these bills from a credit card that I don't have? Or sometimes they will try to apply for a loan with your information and then it gets denied. And then you get a letter saying like, hey, you know what, we denied your application because of this and this and that. And you're like, I didn't apply for that. So that's why it can sometimes take a while before you realize that it's happening. But when it does happen, make sure you report anything, to the police and then to the credit bureaus, which I'll have the information on here right after that. And just depending on where you live, that we have some local assistance places here, and just to get you, because it can always be a process, to call the 3 different agencies, the credit bureaus, and say like, hey, this isn't me, I didn't do this, and all of that. So, and you want to make sure you file a complaint with the Federal Trade Commission, because it's, again, just the more reports that you make, the better, to try and stop these people, even though it's sometimes difficult to find or they're difficult to catch. You want to make sure that you've got them reported. Okay. The National Crime Prevention Council has this handy dandy guide that it's all about how to keep yourself safe. It's how to prevent identity theft for consumers specifically, but it's very helpful, and you can look at that. That's online. Like I said, I can send everyone a copy of this PowerPoint. I'll do a PDF version of it, and you can have it, so you have all the links to the things that are on here. So how do we prevent all that stuff, right? We just said, if something is too good to be true, then it probably is, right? So be wary, question everything, ask all the questions, okay? Don't be afraid, and don't be afraid to, hang up on the phone when somebody's calling you and says, oh, this is the IRS and you owe money from, taxes 10 years ago or something like that. The IRS is never going to call you. Neither is the Social Security office. They will only contact you via mail. So, if ever they do call you, just hang up the phone. That's happened to my mom too. And she called me, she's like, and she's all worried, like, hi, Mija, like the Social Security, like they're going to cut me off. And I'm like, no, Mom, no, don't answer. Like, and I always tell people, if you don't know the number, don't answer the phone. If it's important, they will leave a voicemail. Pretty much everyone has a cell phone now. I know there are still some people that have landlines, but pretty much everyone has a cell phone. So if you're looking at this and it's a number that you've never seen before, then don't answer it. Like I said, if it's something important, let them leave a voicemail and you can just call them right back. I do that all the time, and my friends know that, so that if ever they find themselves in a situation where they don't have their phone, I'm like, just leave me a voicemail and I'll call you right back at whatever number you leave me. But, because you have to have that system too, right? You have to have somebody else checking out, or like checking out for you and having your back should you need it. So make sure you have that with either your spouse or your friends or whoever, okay? And again, if somebody is calling you for information, if you didn't request, if somebody's calling to try to sell you whatever it is, tree trimmings, a new roof, whatever it is, if you need that, then you go out and seek it, right? Don't wait for somebody to come and be like, oh, hey, I think your trees need trimming. Let me go ahead and do that for you, and you can just pay me later or whatever. Like, no. So I said, don't be afraid to be rude. Yeah, or stern, I should say, maybe not rude. And just keep track of all your statements and everything. If you do have some account somewhere that you haven't touched in years, because that's you're keeping that's your savings, that's whatever it is. Make sure you're checking it at least once a month to make sure that it has in there what it's supposed to have in there. Okay. So monitor all of that stuff. If you're expecting bills and any checks that are coming in, make sure that you get them on time. Okay. If you don't, and you're like, wait, it's been, 2 weeks and I usually get my bill at, on the 15th and it's now the 30th. How come I haven't gotten it? Again, people, mail theft is huge. Package theft is huge. So try to be aware of all of that. Okay. If you can, use a mailbox that has a lock in it. And usually what I do when I have to send mail out, but I think that's mostly because my mail carrier, now they're so short-handed that they used to walk, the entire block and go to every single post or mailbox to, either put the mail or pick it up if it was there. Well, for the last couple of months, they haven't been doing that. They just drive to whatever house actually has mail that they need to drop off, and they don't walk to the rest of them. So if I leave a card on my mailbox to be picked up and he doesn't have mail to drop off for me, that letter isn't getting picked up. It's like it'll stay there until the next day or until whenever I do get mail, and then he has to come to my house to drop it off. So I've been just going to the post office to drop off bills, whatever little bit of bills that I still do with a check, which aren't that many, but yeah, just make sure that you're not just leaving something out and that it's not going to get picked up and it's going to stay there, 2 hours later or 2 days later. Okay. Make sure you're you're shredding any material that you're throwing away. If you don't have a shredder, then just tear it up. I'm a big fan of just tearing things into little pieces. It's fun and it's kind of therapeutic to just tear up paper, right? So make sure you're not just throwing an entire piece of paper with all your personal information on it while you're out there. Get a copy of your credit report. Okay, once a year. You can get a free credit report from every agency once a year for free. And what I suggest is you can stagger them so that you can get it one at the beginning of the year, one at the middle, and one at the end. That way you can see if there are any discrepancies there. Okay. These are the 3 credit bureaus. And like I said, I will send you, I think I have most everyone's email who's on here. So I can send you a copy of this PowerPoint so that you have this information and you can request a copy of your credit report should you want to. Like I said, you can get one, a free one every single year from each one of these places. And these are the 3 major credit reporting bureaus. Okay. Here's 3 different ways that you can order your credit report. And like I said, you guys will have this, so you don't have to write it down and scramble to do it real fast. But we'll go into just this little bit, a little bit of this. This is the last part of my presentation, which is talking about property crimes and a little bit on the violent crimes as well. I do a lot of presentations when it comes to neighborhood watch and keeping yourself safe when you're out and about and when you're at home and all of that. So this kind of ties into it a little bit. And you know, sadly, a majority of the crimes that happen to the elderly are property crimes, right? So thankfully, it's not violent crimes. So, you know, I'm glad to hear that. But still, there are a lot of crimes against property. So, you know, again, we talked about money, or if they steal something from your business or your car or something like that. And of course, this also amounts to financial losses and the feeling of being violated, right? And not feeling safe after that happens. You know, I talk to, usually when I go do neighborhood watch trainings, it's because somebody in the neighborhood got broken into. And it's always the same story. It's like, I don't feel comfortable in my own home, you know, and I think that's the worst part of it all, because things can get replaced. You know, you can replace the TV, you can replace the computer, but there's something to be said about not being able to feel safe in your own home. So, you know, if you can, let's try to do some proactive things instead of some reactive things. That way we can avoid most of the things that that can happen. So ideally, you know, yes, lock all your doors, roll up your windows. This is a little bit about auto theft, but I always tell people the same thing when it comes to your home: lock your door. You would be surprised how many people don't lock their front door. You know, in fact, not too long ago, I think it was a year ago, or I went to my coworker's apartment for the first time because she had just moved, and she's like, "Oh, come check out my new place." And I had my dog with me, and you know, I went and checked it out, and it was a really cute apartment complex. But her, you know, apartment complexes, all the buildings look the same. And like I said, I had never been there before. So we're having dinner and everything. I said, you know what? I need to take my dog out. She has to go potty. So let me take her out. And she's like, yeah, cool, no worries. She's like, I'll leave the door unlocked for you. I'm like, okay. So I went downstairs and, you know, did whatever. And when I came back, I was like, all three, it was 4 doors that were right next to each other. And I was like, oh my God, which one is her apartment? And I just went in, and I'm like, this has to be it. And it's one of those where, like, you know, you walk in and it's stairs to go up, and then the apartment is upstairs. So I just opened the door and started walking up the stairs thinking this was my friend's apartment, and it wasn't. And I scared the living daylights out of this poor girl. I felt so bad. Like, she walked over and had this look on her face, like, what is happening? And I'm like, oh, I'm so sorry. You know, I'm very sorry. Like, I think I have to be next door. This isn't right. Like, and I turned around, as I got to the bottom of the stairs, I looked up and I was like, lock your door. You know, I'm like, so, you know, like I said, I'm surprised how many people don't lock their front doors. And same thing with your car. Make sure you lock your car doors. You know, don't make it easier for somebody to come and steal things. You know, you're creating that opportunity for somebody to go in and steal whatever it is that you may have in there, even if you think it's something that is insignificant, you know, whether like your car charger or the change that you leave in like the cup holder or something like that. You know, you're just creating that opportunity if you don't lock your cars. Our auto theft liaison here, the most recent statistics that she gave me were from 2019, but out of all the cars that were stolen in the city of Austin, 83% of them were unlocked. Okay, 83. And out of those 83%, 57% of them had the keys in them. So, you know, I don't understand that. So please do not leave your keys in your car. Don't leave your car running. If you're going to run in and grab something, whatever, real quick, turn off your car, lock the door, go get whatever you forgot, and come on right back. Okay. So when you're about to get in your car, check the area around it. And there's always tracking devices that you can use for your car if it gets stolen, low jack, all that stuff, but even the OnStar and all of that. So that's something else to look into as well. But most importantly, lock the doors and don't leave anything of perceived value in your car. Okay. Um, so how about, for example, a little bit about preventing theft while you shop. Make sure that you only have with you what you need. Okay. Don't take your family jewels everywhere you go. Just take, your credit card, your ID, like your medicine, whatever it is, the minimum that you need so that you can get what you want and be safe throughout the day. Make sure any packages that you have, the holidays are coming up, y'all. So any packages that you have, make sure that they're either out of sight or that they're in the trunk. And don't just walk outside and like, oh, let me just put all this in the trunk and then walk right back in and keep shopping, because the bad guys are out there looking for people to do this. Okay. Try to do all your shopping at once and then put everything in your car and then you're leaving. Okay. When you're walking to your car, try to make sure that your hands are free, that you don't have just bundles of things to where you can't see what's around you. And if possible, keep either your wallet in your front pants, or if you have a purse, put it across your body. That way it's not, super just a quick grab and then it gets snatched. Okay. And also when, if somebody does steal your presents or something, try to keep those receipts away from all the boxes that you just bought, because that way, because they could easily just walk right back in and say, you know what, let me return this. I don't want it, because the receipt is right there for it. So try to keep those separate as well. Like I said, the holidays are coming up. So, so just be mindful of that. And then there's always, having stuff delivered to your home instead, but make sure that you're home so that, your packages don't get stolen. So I sound like such a positive person today, but just to try to make y'all aware of everything here. So a little bit about preventing property crime at home, and then I'm almost done. If you have timed lights, use them. Please leave lights on at night. Any outdoor lights, please leave those on. Lighting is one of the cheapest and most cost-effective ways to prevent crime. So light up your house. Make sure that there's no dark spots that someone can hide in and all of that, especially when it comes to your doorways and your walkways. Okay. Trim your shrubs, make sure you don't have any, huge bushes or that can just hide, where someone can just hide. Okay. And that last bullet point, the police department can do a security survey on your home. That would be me. I can come out and say, hey, let me check it out, and I'll see, where we can make improvements and where you need more light. Okay. And as far as violent crimes are concerned, make sure that when you're out, try to be out with somebody, make sure you're walking assertively, make sure you are looking people and smiling. Just smile and look them in the eye when you see them walking around. That way they know that, hey, I see you, I know if I have to identify you later, then I know what you look like. So, and use it just as a good morning. I always wave to everybody in my neighborhood when I walk my dog, but I'm mentally like, okay, I can see what you look like now. So, and like I said, try to always go out and be together, or be at least, two people at the same time when you're outside. We talked a little bit about just carrying the cash or credit cards that you need. Obviously, stay where things are lit up and where there are people and, good lit up places, public places. If you're traveling, check with the hotel staff and say, hey, are there any areas that I maybe shouldn't visit, or, something like that. And if ever you are confronted by someone trying to steal anything from you, just give it to them. Like I said, stuff can be replaced. So just give them whatever they want and have them go on their merry way. Okay. This is the National Crime Prevention Council website where y'all can find some information. and resources for lots of elder issues and stuff. So does anybody have any questions for me? I'll stop sharing this, and if anyone has any questions, we can just feel free to just speak up, or, you know, raise your hand, or go ahead, Jesse.
I don't have a question, but I wanted to add on to the part where you said about getting phone calls and being aware of these phone calls from fraudsters and people getting creative ways. My cousin, I'm also from El Paso, born and raised in El Paso, and the majority of my mom's family, they all still live in El Paso, some out here. But my cousin works for the Department of Health, Texas Department of Health, and she's always traveling and flying in and out. And one morning at 3 in the morning, her parents, my aunt and uncle, they're in their mid-70s, they got a call at 3 in the morning. And there is a way to make somebody else's phone number appear on your caller ID and make it seem like you're getting a phone call from that individual. It's very, you know, these apps on the phones nowadays, they can make anything happen. So if you do get a call and it's a number you recognize, and if you get a call like the one my uncle and my aunt got, scaring the lights out of you at 3 in the morning, telling you that your daughter's been kidnapped and you need to send money right now, or something else will happen. That is happening. It happened to my aunt and my uncle, and thankfully, after they got over the panic and the emotion of that time, they called my cousin to verify, and she picked the phone. What's going on? Why are you scared? What happened? So they verified before sending money in, and thankfully they were able to avoid that fraud from happening. But please call that person back if you ever get a call like that, because it is happening. Nowadays with technology, these criminals are getting very, very creative with this. They're able to deceive you. And when it's, you know, 3 in the morning and they're calling you yelling, and, you know, it can be a pretty scary moment. So just keep that in mind.
Yeah, definitely. It's funny that you mentioned that, because yesterday I was with a coworker and we went in to do a presentation, and when we were coming back, the phone rang, and it was a 972. It started with 972, which the city numbers all start with either 972, 974, or 978. And when he saw that, I was like, oh, he's like, oh, it's from the city. I wonder who it is. And we had it on speaker, and it's like, been trying to reach you about your car's extended warranty. I mean, you know, and they've used it. They somehow cloned a city Boston phone number. So yeah, they're getting super clever, you know, and I just wish they would put all that energy into doing something good, because imagine all the great things that they could do if all that energy was put into something positive. But, you know, it is what it is. But does anyone else have any other questions? Because if not, I'll just hand it over to you, Jesse. Oh, yeah, Cynthia, go ahead.
Okay, I had to unmute myself. Thank you very much, Veronica, for the presentation. And I have a question. Did you say that sometimes one of the people could call into the older people and make their voice sound like a relative?
I mean, sometimes, and I think it's not, I don't think it's maybe so much that they make themselves sound like that. I think it's that we don't want to believe that it isn't that person.
Okay.
You know, and I think that's what happened to my mom, because like, hey, you know, like, hey, Thea, this is like Oscar, blah, blah, blah. And of course my mom was just like, oh, okay, cool. Like, she didn't question it at all.
Right, okay.
She did tell me later, she was like, well, I thought it sounded like him. And she even said, she's like, I'm not crazy. She's like, it sounded like him. And I'm like, no, you're not crazy. Like, you know, they just take advantage of that stuff. So,
all right.
I think it's mostly, you know, that we try to see the good in people.
Okay, thank you.
Yeah. All right. Well, Jesse, it's all yours.
All righty. Well, thank you very much, first of all, for inviting me to be on your Zoom virtual meeting today. We originally, funny story, we were scheduled to be on live last year. And Veronica invited me right before the whole pandemic started, I believe, and then everything got shut down. So we had to move everything virtually. So Veronica and I have been doing these virtual meetings now for the last year. So it's good to see you all. Hopefully we can get together in person, soon here. But in the meantime, we'll make the best of what we have right now, right? So I will briefly introduce myself and go over my part briefly. We do have another guest coming after my part, and I want to make sure he does have a chance to go over his piece, because it's practical skills that can be used day to day while you're out in the street shopping, running errands. And I think the information he has to present is very beneficial. My part is to go over what we sometimes do every month, but take for granted, or sometimes overlook, not take for granted. We overlook some things that happen at the pharmacy, and we end up getting taken by the pharmacy sometimes, and that money that comes out of our pocket is a pretty significant amount, and we could have avoided that from happening. And so my piece today is to go over that. A little bit about who I am. Again, I was born and raised in El Paso. I went off to college in California, got my degree in economics, and after graduating, I went into the health insurance world, and I've learned the ins and outs and the good and the bad, all that exists in the health insurance industry. And so I'm here to tell you, the nonprofit organization I work for, the Beta Foundation, we are dedicated to helping Medicare beneficiaries find ways to save money and minimize the impact on chronic diseases. Right now, the statistics are really, really high for the number of people that have a chronic disease, such as diabetes, Alzheimer's, and have Medicare. And all those prescription drugs that patients are taking are just out the roof. The co-payments are way out there, and there's ways to avoid them. There's ways to minimize them, and that's what I want to go over with you today. And so I will show you my screen here, and I will also be able to email to you everything I will show you here. Let's see if I can get this here going. Part podcast. Here we go. Can you all see me still? Can you see my screen yet? Here we go. You see my screen?
Yep, we're good.
You can? Okay, good. All right. Then let me go to that. So my presentation here is 8 ways to defend yourself from the high prescription drug costs and learn why they're costing so much. And I'll give you a quick rundown of these 8 tips of about 20 slides in my presentation. So I won't be going over each and every one of them. Again, my name is Jesse, and the instructor coming up after me, his name is Cliff Byerly. He'll be coming on at around 11. So I will go very quickly through mine, but again, I'll email all the information to you so you have everything in writing. So the numbers, the statistics, everything I mentioned earlier, Americans are spending upwards of $10,000 annually on specialty prescriptions, and a lot of these are ultra expensive drugs because they're brand name drugs. All that means is they have a patent, and during that time that they hold the patent, nobody else can make a drug like that. And even though the ingredients to the drug are the same, the patent is keeping these other generic brands from entering the market, so therefore they can keep those prices where they're at. I'll give you some examples of some of these medications in just a moment. But now all of these co-pays and out-of-pocket costs, they will vary significantly from the plan to plan. There's many different types of plans out there. Some people don't even have a prescription drug plan, and that's one reason why people are paying way overpaying for their prescriptions at the pharmacy, not having a Part D plan. And in fact, if when you are eligible for Medicare, many people don't know this, when you are eligible for Medicare and you get your Medicare card with Part A, and if you activate your Part B, and you don't choose to get a prescription drug plan, which is Part D of Medicare, then at that point in time, if you don't choose to get that Part D, and if you don't have any other coverage elsewhere, then you will be hit with a Part D penalty, and that continues for the rest of your life. And that's added on to whatever your Part B premium is, and that's taken out of your Social Security check. So many people are paying a Part D penalty because they didn't sign up during the time that they should have. And so I'll go over that in just a bit more. The other plans available are Medicare Advantage plans with the Part D already included in that. They're called Medicare Advantage prescription drug plans. And there's also employer group health plans that include prescription drug coverage. And then if you served in the armed services, such as the Navy, Army, Marines, you might have the VA, TRICARE for Life, or TRICARE Champ, those benefits, okay? Those are all examples of prescription drug plans. And the one problem that we are seeing is the formularies, which is pretty much a list of medications that every plan has, they change each and every year. And when they do change, that can mean an increase or a decrease in your copayment at the pharmacy. The other item is the brand versus generics. I'll give you an example, Crestor. How many of you have heard of Crestor before? Okay, so Crestor is a brand name for rosuvastatin, and if you go and buy Crestor, you will pay on average about $350 for 30 pills, where if you get the generic brand, it's $0 for the same amount. Again, the ingredients are the same, one just has the brand name, the other one doesn't. The other problem we're seeing is the government regulations. Sometimes they're good, sometimes they're not. There is one right now called the Part D savings model, which has capped the price of insulin and diabetic medicine at up to $35 maximum, okay? Now the plan has to participate in that program in order for you to get that price. Now, how do you know which plan is the right plan to pick for the prescription drugs? In Travis County alone, you have over 35 plans available to you. So how do you know which one to pick? And so that's where I highly recommend you begin to look at your plans, especially during this time of year, which is the Medicare annual enrollment period, time to shop between October 15th through December 7th. Begin to look at your plan and look at the formulary within that plan. Look at the pricing, look at where your prescription drug falls within the tiers. Many plans have tier 1 through 6, tiers 1 and 2 normally being the generic brands, 3, 4, 5, and 6 normally being the brand name drugs. Look at those and see if your drugs have moved from one tier to another. Compare, very important to compare during this time of year. Compare what one plan offers versus another plan. Some of you might know or might not know this app on the phone. Going back to the technology on our phones, there's an app called GoodRx. And on that application, you're able to find, I'll show you an example, you're able to find prescription drugs at all the pharmacies where you live. You just type in your zip code and you'll be able to find the exact price at that pharmacy that you're looking at. And it'll tell you what that medication will cost when you show up. And in some cases, you'll find on GoodRx, on my phone right now, you'll be able to find on there the name of the medication. I don't know if y'all can see that, but you'll be able to find the name of the medication and a brief description of the medication, the brand name of the medication, and if there is a generic equivalent to that medication. So very important to compare and see where your prescription drug is, and also whether or not you are in the donut hole. There's a terminology we use in the Medicare world called the donut hole, also known as the coverage gap. When you fall in that donut hole, because you've already paid and gone through your initial coverage limit, which is currently $4,130 in out-of-pocket cost that you've paid for your medication. Once you go into that donut hole, then you're paying a much higher cost for the same medications. And so you need to know if your medication and the cost of your medication will get you into the donut hole, what month in the year you'll get into that donut hole, and when you get out. because all that determines how much you'll be paying in a co-payment at the pharmacy. The Part D savings model, this is something new. This is something that just came up, and there are plans that are participating in it. The majority of them are now beginning to look at it and see, just simply because of the fact that there's, again, a lot more people with a chronic disease such as diabetes on Medicare. And so the Part D senior savings model allows those plans to offer a bigger set of formulary insulins for $0 and up to $35 of a copayment for 1 month, okay? So before, you might have heard of the insulin costing way more than $35. Well, if you have a Part D plan that participates in this model, the maximum you would pay would be $35 for that copayment for that month. Okay, now the Center for Medicare and Medicaid Services, also known as CMS, they're estimating that the senior savings model will save people with diabetes an average of $446 per year in out-of-pocket insulin costs. So it's a pretty big deal. If you're a diabetic and you go and refill your prescription every month, that's a pretty huge amount of savings you can save simply by looking at the formulary for the plan that you currently have. I said it before, I highly recommend it. Do an annual review, and we call them RX reviews, a prescription drug review of those medications, determine whether or not there's a generic alternative, and then talk to your pharmacist. Many times you can find from your pharmacist or your doctor that there is a better alternative to maybe save you a little money. Now, here's the 8 tips that I told you I'd share with you on how to save money. Buy generic. Now, I understand there are some medications that preferred brand name just works better, and that's something that you and your physician have determined that is working better. But if there's a generic alternative, try it out and see if it works. Use a preferred in-network pharmacy. Go to the pharmacy that's in the network for the plan that you've chosen. And if they offer the mail order option, that'll save you a lot more money too, and then get delivered right to your doorstep. And many times they'll deliver up to 3 month supplies delivered right to your door. Now, the Good RX program, that's the coupon app that I just showed you on the phone earlier. I really, out of all the applications out there, I really find that to be very useful when you're out there shopping for your prescription drugs. You'll find a lot of discounts on that application there. So if you don't have it on your phone now, I would recommend you add it. Just go to the App Store on your phone. If you have an Android, I believe it's the Google Store. If you have an iPhone, it's the Apple Store. And then look up Good RX, and it'll pop up on your phone, and you can start typing in your prescriptions, and you'll see exactly what I'm talking about. And all the pharmacies and all the drugs that are in there will just blow you away. The information there is just very useful. Another thing that I've learned is that the manufacturer of these drugs, they also do offer support to pay for these drugs if you cannot them. I have a very good friend of mine, actually my friend who introduced me to Veronica, paying a whole lot of money for chemotherapy medications, and the manufacturer was able to provide them some help to pay for those medications, which is a huge help. There's also the Extra Help, also known as LIS, the Low Income Subsidy. It will help you reduce the cost of your medication. And that's another option. You can apply and determine, and then the agency will determine, the agency for Medicare and Medicaid, they'll determine what level of help you'll get, whether it's 25%, 50%, or even 100%. Now, keep in mind that is not Medicaid. It is not Medicaid at all. So you don't need to worry about that. This is a whole different type of help, and it's only meant for prescription drugs. And that's what it's called, Extra Help, or LIS. Okay, the other option and another way to save money is, again, talking to your pharmacist and getting a comprehensive medication review, or CMR. And that is where you and your pharmacist will get together and go over your list of drugs, a list of medications, and then determine which ones you still need to be taking and which ones you don't, which ones are repetitive, which ones have the same ingredients, if you're just pretty much taking the same drug, just 2 different pills of it. And then if you have a Medicare broker, make sure that they do this annual prescription drug review for you, because that's when you'll see what the savings could be by looking at all the medications you're taking. Again, I won't bore you with all the details on here. I will be emailing everything that's on here to you. This is an example on my screen here right now of the different tiers and these prescription drug plans. We have tiers 1 through 5. You'll see the top 2 tiers. There's $0 copayment for top tier 1, that's generic brands. Tier 2, also generic, you have a little bit more. Tier 3 is where you typically find your insulin and your diabetic medications. Those are here shown at $35. Again, you'll get that in an email. That's just an example there. Here's an example of what the GoodRx coupon that pops up on your phone will look like. It'll show you the price, it'll show you the name of the medication. And the comprehensive medication review is part of a program called medication therapy management. Okay, it's a big deal for healthcare providers, and they actually get rated on these. They get rated based on a STAR system. And so medication therapy management is a service provided by healthcare providers, including the pharmacist, to ensure that you're getting the best therapeutic outcome for their patients, okay? So a lot of people don't know about this, and they could be taking advantage of it. And again, saving some money or even eliminating medications altogether that you no longer need to take. So again, that is the conversation you would have with your physicians, with your pharmacist, not with your broker. You want to talk to your doctor or your pharmacist about what medications you need, what medications you don't need, and then from there, start eliminating based on that info that they give you. Okay, the RX review that I mentioned, that's a prescription drug review, and I recommend you do it every year. This is an example of the form that I use to help my friends and family. My parents, they're on Medicare. They take a few medications, thankfully. They're getting into better shape physically, so they've been able to get off of the high cholesterol medication. So we put them on here, we figure out what the dosage is, how many pills per month, and then we go from there, okay? A lot of people I found don't have a list of the medications you take. And Cliff, when he jumped on, he's also paramedic. He's doing paramedic work in the state of Texas too. And he tells me that a lot of people when they show up to the scene, older people, they don't have a list of medications they take, and the emergency is that their medications had an interaction, negative interaction. And so when they're trying to find out what the medications are, they're asking for the list and they don't have one. I highly, highly, highly recommend you write down a list of all the medications you're currently taking and keep it in your purse and your wallet. Keep it somewhere to where somebody in emergency response can get that and see what medications you're taking and then go from there, okay? Again, that is my presentation. I'm hoping Cliff is on right now. I will go ahead and give you my contact information here. If you have any questions, I know I went through it pretty fast, but I wanna make sure I do answer your questions if you have any questions. Number one thing, if you take anything at all from everything I've just said, I highly, highly recommend you do the checkup review with your broker, okay? Discuss your medications with your doctors and your pharmacist, and then also consider a wellness lifestyle to maybe eliminate some medications that could be no longer of any use to you if you're going to the gym, staying in better shape physically, mentally. Wellness lifestyle change really does help. My mother is a great example of that. She started going to the YWCA before the whole pandemic happened, and she just saw a dramatic change in her health by working out, even if it's 2 or 3 times a week. Big change in her health. It allowed her to get off some medications I mentioned and save a little money on that too. My phone number is up on the screen right now. If you have any questions, feel free to call me or text me. If I don't pick up, leave me a voicemail. It's usually I'm on a meeting like this or with somebody, meeting with somebody in person that I don't pick up my phone, but I usually return calls within 24 hours. You can also email me at jesse@betabenefit.com. My websites are on there, the Beta Foundation.org and MedicareClasses.com. You'll get basic information, all educational resources on here. Any information, any question you might have on Medicare, you more than likely will find the answer on those websites. And again, feel free to give me a call. I'm more than happy to help. My heart is for seniors. My passion is helping seniors, and I'm here to help you all. So please reach out to me if I can help in any way. Any questions right now? Well, thank you. I see it clapping. Thank you. Thank you. I see Cliff is on here, so I think I'm going to hand it over to Cliff if there's no questions. Oh, you do have a question. Go ahead, Cynthia.
Okay, Jesse, I want to thank you first of all for your presentation. It was well done. I do thank you for talking about the comprehensive medication review, because I didn't know anything about that. When you go to the pharmacy, they always ask you, do you need to speak to the pharmacist? And I said, no. But now that I think about it, since you told us about the comprehensive medication review, I'm going to do that, because I just had a total knee replacement and I was on extra medications, which I said, I wish I didn't have to be on so many different medications. So what I'm going to do is let them talk to me and tell me if I need some of the medications that I'm on. And I will be so happy to let the pharmacist tell me, well, you don't need these 3 anymore, or you don't need these 2 anymore. So thank you, Jesse. Thank you so much.
You're very welcome. You're very welcome. And so now I'll turn it over to Cliff. Cliff, are you there?
Yeah,
there you are.
Hear me?
We can hear you loud and clear. Yes, sir.
All righty. All right, guys. So what I'm going to talk about is some self-protection options. A little background on me. I retired from LAPD in 2016 out there in South Los Angeles, 23 years in the Marine Corps. Now I run a company out of Kerrville, Texas. And right now I'm in Dallas working with some law enforcement guys sitting in a junk vehicle. So guys, what I'm going to go into now is just some self-protection, some self-awareness. And Jesse, can you guys hear me fine? Cool. So the first thing I want you guys to write down is an acronym, GO-TWA, G-O-T-W-A. So the acronym GO-TWA, guys, is going to help you out, because what it is GO-TWA, what it stands for is you're going to let others know where you're going, others you're going with, how long approximately you're going to be gone, what to do if you don't come back in that time frame, and the A is basically like what actions you want me to take or a family member to take if you don't come back. So the way GO-TWA works is like, I'm going to tell my a family member, I'm going to Walmart. I'm going to go with my, I'm taking my friend John with me. I'm going to be gone approximately an hour and a half. If I don't come back in that hour and a half, wait another hour. And if you still don't hear from me, call my daughter. So that's GO-TWA. And that's actually been utilized in a lot of the senior living homes. It's basically they put it as a board, a checkout board, so they know exactly who to contact. So that's GO-TWA that I recommend using, especially if you're going on trips for any length of time. The next self option, guys, is your biggest vulnerability comes from entry and exit points. So when you drive into a parking lot, getting out of your car, getting back into your car, the entry point to the store that you're going or the place of business that you're going, and leaving that place of business, exiting, is your most 2 dangerous points. So now as you pull up into a parking spot, guys, make sure you look around your car. Is there anybody sitting in cars next to you, in front of you, behind you? that looks out of place. And also, before you get out of the car, visualize the direction that you're walking to the place of business. Is there anybody loitering around the doors? Any place in between the cars? So plan your route to the place of business that's free and clear. And the same thing when you exit the place of business. Hang out, before you walk to your car. Stand by the exit door at your place of business and see if there's anything that you don't feel right about. Being, seniors and stuff like that, people see you as easy targets. So always listen to your intuition. If something doesn't feel right, it probably isn't right. So listen to that. Also, guys and gals, pick your self-awareness. Don't let somebody walk right up into like your personal space. If you see somebody approaching you, address them, acknowledge them from like 30 feet away versus 3 feet away. Have them, make up a story, say, hey, I just got out of hospital for, COVID or whatever. I don't want to get you sick. So stand over there. I can talk to you from there. So don't let people walk right up to you. It's like always try to have a barrier between you and when you're talking to an unknown contact. Some stuff like that. Is there any questions or problems you guys experience that I can help you with?
I just have to share that someone came up to me outside of Randall's here and completely out of nowhere. This was before I started working for APD, which means I was nowhere nearly as observant as I am now. But I was walking in and this woman out of nowhere straight up just came and hugged me. And yeah, and I was wearing this dress that I guess made me look pregnant. And so she was like, oh, congratulations. The Lord wanted me to tell you that, I don't know, something about the creature and the child and I'm like, get away from me. But you don't think about that stuff. Like she just came, I wasn't paying attention, honestly. I was looking elsewhere and she just came out of nowhere. So I think just like you said, kind of being very aware of your surroundings and because I was like, ew.
Yeah. Well, last night I took the wife to dinner and there was a lady, she got out of her car and a homeless guy asking for money or whatever was literally, all her attention was in the trunk of the car and he was like literally right behind her talking. And that is a good way to end up in your trunk because you're not paying attention. And then she basically walked to the parking vending machine with him right next to her. I mean, like personal distance with her purse is slung over her shoulder. So it could be grabbed. So for ladies also, when you're carrying a purse, don't put the strap cross body because bad guys want property, body, or life. So if they go to grab property, you don't want them to be able to pull you to the ground or wherever. So it should be just literally like slung off of like one shoulder or like basically like a clutch bag so it doesn't pull you off and cause further injury. Also, don't have valuables. What I mean by valuables in your purse, like your social security card. Like my grandma, she carries her life in her purse, no matter what I tell her, but like birth certificates, social security cards, stuff that cannot be replaced easily or that can be continue to be used for like identity theft purposes. Don't carry that in your purse or anywhere on your person, wallet, what have you. All that other stuff can be replaced, but that stuff can create years of problems with identity theft and stuff like that. So, set yourself up where if you are in the trunk of your vehicle, you're kind of bladed a little bit so you can actually see, people coming up from whatever side is facing the parking lot. Never have your head in the trunk with your back totally to the parking lot. If you do get in your car, if you're going to balance a checkbook, check your phone. First thing you should do when you get in your car is lock your doors. Then you can do everything else from there. But self-awareness, pay attention. Like in the military, they call it 5s and 25s. So when you park your car, you go 5 meters around your car to make sure it's clear. And then you make a bigger circle. And then you plan your route to and from the place of business. So same thing when you're leaving. It's sad that we have to do that, but older people are targeted. Okay. So you have to be aware of stuff. Don't be an easy target, and by being aware, picking out stuff, if it's 90 degrees out and somebody's wearing, a coat, like that might be a clue they're trying to conceal a weapon, and what we talk about is anomalies. Okay. There is a normal human pattern of everyday life, like when you go out to HEB, Kroger's, or whatever, and then there's stuff that doesn't fit the normal human pattern. So you're trying to pick out stuff that doesn't fit the pattern and then plan accordingly, like trying to avoid it. Also, like verbalization skills, learning how to talk to people, and de-escalation of stuff. Property can be replaced. Life isn't, like your life can't be. So, don't get in a fight over something that can be easily replaced. So that's pretty much the highlights for self-protection, guys. But like self-awareness, know what's around you and have a way to the place of business, leaving the place of business, and just managing unknown contacts. Don't let people walk right up on you and, ask you for like, hey, do you know what time it is? Do you know what the direction? Because bad guys, they tend to start a conversation so they can get within that distance to either hit, grab, or escalate force. So don't let people get within that distance. If you can acknowledge their presence from 30 feet away, that's way better than 3 feet away. So don't let people get close to you. If you can, if you're at your car, put your car door, if it's open, put your car door between you and them. Have barriers, shopping carts. I've seen a elderly guy I worked with. He used his walker as a barrier that kept him from being assaulted. So there's always something in our environment that can be used to provide as an advantage to us. Okay. Is there any questions on that? Just kind of down and dirty.
Thank you, Cliff. And by the way, Cliff does have a lot of programs available for civilians also. Am I right, Cliff?
Yeah. I work with people, nurses. I've trained everybody from military to kindergarten kids. So, and I think that lady had a question. There was a lady that had a question there.
Cliff.
Yes, ma'am.
Thank you, first of all, for your presentation. As I've said to the other presenters, you did very well also. A thing that my husband always tells us in the church is to pay attention to your surroundings. So everything you said about that was really good and should be taught more. What I notice when I go into the store a lot it's not just older ladies, but women of all different kind of ages. They put their purse down in the little, the first little place that you can lay yours. And then they walk away to find something. Well, I say to myself, now I know some people don't want to be talked to. I say, but I've got to tell this lady, she needs to get her purse, stay with her purse or do something. And so when I do go and share with them, honey, don't walk away with your purse in your basket like that. Oh, thank you.
Yes,
So
ma'am.
that's another thing we should do. Help each other out. Because sometimes we just don't think.
Yes, ma'am. Another thing you can do with the purse too is put like a handkerchief over the top of it. So it's one, it's a visual barrier, but it's also harder for them to just reach in and grab something because it's hard. If they can't see what they want, they're not going to take it.
Okay, thank you.
You're welcome, ma'am.
Thank you, Cliff, for jumping on board with us today. Thank you very much. And I know you got to get back to training Dallas.
Buddy, you got my contact.
Great. Thank you. Have a great day.
All right. Be safe.
You too.
Well, y'all, that was great. Thank y'all for joining us. I want to take a quick couple of seconds just to thank Rob here from Age of Central Texas for putting this together and letting us use his Zoom account and all that. I think, it was great. And we really, really appreciate you, Rob. So thank you so much. I will share my email here in the chat. If y'all have any questions afterwards that you think of, and because sometimes it takes me a little while to process stuff, and they're like, oh wait, how come I didn't ask this? So if you think of something, feel free to email me, and I have everybody's email on the call here, so I will send you all copies of the presentations. And like I said, if you have any questions, please do not hesitate to reach out. But I thank you all for your time. I appreciate y'all being here. This was our first virtual SALT fair, so hopefully next year we can do it in person, but but like I said, thank you all for joining, and I hope you have an excellent rest of your day, everyone. Thanks, y'all. Bye.